Maybe you're a new patient that hadn't, it's been 10 years since you've been to the dentist. You're a little anxious. That's understandable. But the main thing is, we're going to bring you in. We're going to make sure you're comfortable. We're not going to just jump in there and do a lot of things without going over all that with you. We're going to make sure you understand why we've made these recommendations, what the current condition of your mouth is, and then we'll come up with a plan. You may be one of those that's super anxious. And so, we've got laughing gas, nitrous oxide is what we call it. And so, for a lot of patients that may be a little anxious, sometimes that's all it's needed. We'll administer that, kind of just take the edge off a little bit. It doesn't knock you out, but it does help relax you a little bit. And for some patients, that works out really well. We have, a lot of patients that don't want that, and that's fine too. 20 years ago, you may have gone to the dentist and they said, okay, you need this, and that's it. You either just did it or you didn't. With the technology that we have now, you get to be a part of that, almost co-diagnosing things. And so when you come into the practice, we're going to not only take the traditional x-rays that you probably had, but we're going to take a lot of intraoral pictures. And so that way, if I say, you've got a cavity on this tooth, or this, old silver filling starting to break down, or we've got a lot of gum recession in this particular area, well, there are probably areas that you can't see when you look in the mirror. And so we're going to take pictures and we're going to put them up on the TV. And so you're going to be able to see those and understand why we're making these recommendations. You're not going into this thing blind. So, at the end of the day, when you leave, I want you to know the condition of your mouth, and I want you to know what's going to be required in order to try to fix those things.